I mean, here we are, beginning of September. Really, I class this as 8 months into the world living with COVID. And I was just asking Catherine, who's sitting next to me, to remind me, how long is a marathon? How many kilometers is a marathon? And she was saying it's 42 kilometers. And kind of my image today, 8 months into my work as envoy, because I started working as envoy in February, is that we're at about the halfway point in this marathon. And those of you who've run marathons will remember just how tough the second half is. And when you're in the second half, you hit a really difficult point, what's commonly called the wall, and you just cannot go on, and you have to really pull yourself through it. And I think we're coming up to the wall. And I'm going to share with you why I think that's happening, and just say why I also think that the approach that we've been amplifying, that's been coming from the WHO and others, is the right approach, and we just mustn't give it up. So, and I'm going to go through this and explain. I've got some excitements and some difficult points. I'd really want to have a conversation, because it is through these discussions that certainly I am positioned for the work that I'm doing. And I've got several really good opportunities coming up with governments, with local authorities, with businesses, and with a number of different professional groups. And I want to get that right. Now, some of you, just diversion coming now, some of you know that a frequent visitor on these briefings is my daughter Polly, who usually appears with her son Isaac. And there is Isaac sitting there. And just what Polly is doing is showing us that there's a new addition to her family called Otto. And so here is Otto with Isaac sitting at the kitchen table in Polly's house in Brill, just outside Aylesbury. Isaac, you can see, is showing that he's the very grown-up boy who, with his new baby brother, is just showing him precisely what good table manners is. And Otto, possibly no more than 3 days old, is showing that he's got head control at this age. Polly, it's lovely to see you here. And how is Otto this morning in getting on?
Great. The boys slept really well. We're pleased.
Very good. So thank you. Loy has just sent congratulations on the new grandchild. Annie is clapping. It's great. Thank you very much indeed, Polly, for that little cameo. Most grateful to you for being with us. I want to give a special shout out before we start to Paul Garner. Paul wrote me a message 2 days ago acknowledging that the work that we've been doing on really drawing attention to long tail COVID is beginning to pick up. And Paul, I hope that that there has been further success on that, and that you've been able to really make certain that the issue of long tail COVID and the possibility that 5% of people with COVID go on and develop the long tail is now becoming more understood and appreciated. And thanks to your work, that's happened. Paul, a word from you. Did you get success?
Thank you. I think it's definitely on the agenda now, and it's really important that we consider not death or getting better, but when the disease actually goes, and there are thousands of people out there suffering really bizarre symptoms, but totally incapacitated and finding it difficult to work. And of course, when they start working again, if they overdo it, it makes them ill again. huge amount of mental distress caused by the virus. So it's not just the virus and the reaction to lockdown that people are unwell, it is the actual virus doing this to people and then its effect on their body. So there was 800 people on a British Medical Journal open seminar yesterday where it was openly discussed. So it's really important. We need guidance now. We need to bypass these existing medical structures and get a move on with things. We can't wait for papers to be published in the Lancet for then guidelines panels to pick it up 6 months later. We need action now, and I hope that is going to come across. That's an important narrative for us to take forward, some more rapid decision making. But thanks to the support of this group.
Thank you very much indeed. So in really, Paul, by the way, Paul is in his house in St Michael's Hamlet, as it's called sometimes, just south of Liverpool Centre. And I'm saying that because I've stayed there and I'm recognising the door behind you, Paul. It's lovely to be connected with Liverpool and the School of Tropical Medicine. So that's the theme of today. We're in a marathon. We're about halfway through. We have got a lot of tough issues ahead in COVID world, and I want to spell them out. I'm going to be, and these are the issues that are the basis of my media work and my involvement in different webinars during the next few days, over the weekend and next week. Number one, the virus is still here, is spreading, and is picking up again in terms of transmission. And we're seeing it all over the world, but there's a systematic effort by a number of governments to restrict testing. And there are good reasons for it. Partly just there has been just a huge push for testing, and it's kind of overwhelmed the global laboratory system. There's a shortage of reagents for PCR. But governments have also realized that the more they test and publicize test results, the more problems they have. And yet at the same time, we need these test results to know where the virus is. So we need to find some way to change the understanding of how this virus is spreading. My own view is that we just have to, all of us, accept that the virus will spread in any society where there's a lot of physical contact between people and where there are not the physical distancing, face protection, hygiene, self-isolation, and other precautions being followed. And so why don't we just accept that continued spread of this virus is inevitable, and what really matters is the way in which societies organize themselves to deal with it. And we have to keep making the point that it's a dangerous virus. Dangerous because it kills, but dangerous because 5% of those who get it have long-term performance issues, physical, emotional, mental, that will set them back. And Paul's work and the work of others is showing that young and middle-aged adults are physically affected and mentally affected for weeks after their initial exposure to COVID. So keeping the message strong that it's a dangerous virus that's in our midst, that is continuing to spread in all societies, is really important. And instead of people being surprised that they've got spikes and surges, it's necessary to say this is inevitable. The virus doesn't get bored. The virus doesn't suddenly stop. It goes on. The second key point that comes out of this thinking about the virus is that there is going to be a dramatic surge in cases all over the world in the coming few weeks. And this is going to be particularly pronounced in places that have managed to get their numbers down. They'll come back up unless societies can continue to do the physical distancing and all the other precautions that I've said. And so much is going to depend on the quality of local action to detect, interrupt transmission, trace the contacts, and suppress outbreaks and stop them building up. So the second point that I am really wanting to stress is that local action is the only way to go. Local action that puts the community at the centre. 2 days ago, I joined the leader of Greater Manchester Council. The Greater Manchester being one of the big super local authorities that have been established in the UK. And the leader is a former health minister called Andy Burnham. And he and I, by chance, were being interviewed together on Channel 4. And he has been making the point that in the UK, stop these surges from turning, these spikes from turning into surges and outbreaks, it is necessary to get stronger local action with all the different actors coming together, religious, commercial, community, local authority, and business. And he's been trying to convince central government that that's the way to go for the future. And he's got an opportunity to do so in the coming weeks. And it was lovely to have a chance yesterday to meet with some of his team and just to feel their understanding. I was thinking while I was hearing from members of his team, the health people in particular, I was thinking of what Annie has been saying repeatedly in these sessions. You know, it is political. It requires organisation of political actors at local level. It requires a different approach to government, from central instructions and prohibitions and new rules. Instead, a way of empowering people to be COVID ready in their communities. So that instead of talking about enhanced restrictions, new limitations, and presenting the future as just bounded by lots and lots and lots of restraints and constraints, it's absolutely extraordinary to hear. I don't really want to mention the name, but I'm so determined, I'm so proud of the person who spoke, who is one of the leaders of the public health teams in Greater Manchester, saying this only works if communities are empowered and find the power to be able to cope with this virus through their own resources. And the doctor concerned was reminding me that the sort of work that's been encouraged by the United Nations Disaster Risk Reduction Programme is exactly that. And I mean, these are things that are done very much below the radar. You know, they're not big noise stuff. You don't get headlines for it. But stimulating community-led action to deal with a stress and a crisis, bring people together, is so powerful. So having started by saying, this is going to get worse. There is going to be more cases building up. There is going to be more suffering because of the long tail COVID, as well as the deaths. The second point, as we go into this next phase of the marathon, is local action is the way to go. Whether you're in France, or in UK, or in India, or in Nepal and Bangladesh, or in Africa, South Africa, East Africa, West Africa, or in Latin America, or in the Middle East, or in the US or Canada. It's got to be empowered local actors working together to get on top of COVID spikes the moment they appear, and to do it with pride, and to do it with a sense of extraordinary achievement, because that's where the battles are going to be won. My third point is that it's going to be really, really tough for governments and for people. I just want to say, Farhan Tazib, you might want to try to mute your phone. Thank you very much. I just want to say that it's tough for people, tough for business, tough for government. You know, we're going to ask people to do all this local action and this community level energy, and they're going to say, where's the money? And that's because we're now going into a global recession. That some of you may have read it, that we'd had the downturn associated with the pandemic, but now we've got the added downturn, which is associated with the spiraling recession linked to the pandemic. And that's going to be a tough one. You know, the schemes in the US and Europe and other so-called advanced parts of the world to protect people and protect business by pumping in government money, they're going to run out, because there is actually a real problem. And I mean, I follow the UK because I subscribe to UK newspapers. The situation is that in the UK Finance Ministry or Treasury, they are absolutely at the point now where they're saying you just can't go on pumping money in without raising taxes. And so we have this massive challenge of how on earth is it going to be politically okay to raise taxes when anyway everybody is feeling so anxious about the fiscal situation. Businesses certainly do not want to be taxed more when many of them are having to lay off staff and accept lower profit in their profit and loss. And so my point number 3 is that the state of the recession, local and global, is really serious. And of course, if you're running the Ministry of Finance in a developing country, you're also in trouble because any special facilities from the International Monetary Fund or other sources are getting really, really tight. So we're going into this second phase of our marathon with not too much spare fuel in the tank, spare energy in the financial situation is very tight. So local action, but at the same time, challenges with resourcing it, leading to individuals, small and medium enterprises, bigger businesses, national governments facing a very, very tough time. And so what are the resources that we as a global society are going to bring to bear for this second half of the marathon if the cash is tight and if we're going to be hugely dependent on local action, but it's going to have to be paid for? What are the resources that are going to be there? The fundamental resources, people. I want to go on and on about that, but people are going to be the solution to this ongoing crisis. I think that business is going to be hugely important. Business has to keep going. And at the same time, the business needs to be able to create the kind of conditions within which customers, employees, suppliers, and others feel valued. And the center of moving ahead on the second half of the marathon is the quality of relationships between people and those with authority. Is there going to be enough trust and respect? Are governments going to be able to respect their people? Are businesses going to be able to respect their customers and employees? Are local authorities going to be able to draw on the energy of their communities without struggling with huge political conflict? Well, trust is being dented on a daily basis by a small number of leaders who believe that the way in which they will be able to hold on to power is by sowing the seeds of mistrust and hate. And so we really have a choice. Do we give in to this style of leadership? Or do we actually say, no, that's not the way ahead, that's not the future? Being unpleasant about others on a constant basis, ridiculing people who are fighting for human rights, opposing action to deal with long-standing discrimination. We say that that is acceptable behavior. All it does is it sows the seeds of mistrust and hate. And so for me, the vital requirement as we move into this difficult phase of the marathon is to see what can we do to try to plant the delicate seeds of the trust flower that will help us to move through this. I'm still putting a lot of hope in businesses. You know, having looked at the history of commerce over the years, you see time and time again, businesses can only function in the context of trust. Yes, we get lawyers to come and write contracts and so on. But actually, the nature of commerce, certainly modern commerce, but also traditional commerce, in my view, is that it's done within an atmosphere of trust. You give your word, you keep your word. You make an undertaking, you do your best to fulfill it. You say you're going to favour the interests of those who have least opportunity, you do it. You don't just go off and do the reverse. You make a commitment, you fulfill it. And so for me, trust is going to become a more and more important facet of the future. And probably is going to be more important than just about any other variable that we can bring on board. As I look at experiences of food plants, really good discussion with the CEO of a massive food operation in Australia yesterday. And he described yet again that the only way he's been able to reduce the potential for clusters in his plant is by working with the unions and with Labour to create the conditions so that people don't have to come to work when they're sick. Very simple. I mean, it has financial consequences, but if you want to avoid your factory being closed, then that's what you have to do. If you want to avoid your school being closed when you've got cases coming up, you've got to be able to get the full participation of everybody and make certain that there is a recognition that nobody is going to be endangered, child, teacher, or parent. And in the long term, as countries like Singapore have shown, if you do want to be able to create a society where there's not a constant risk of COVID, you have to address the structural challenges of people working in really cramped conditions and living in a totally overcrowded hostel accommodation. And that all comes back to trust. It's got to be based on values, and we can over time explore the values, but we have no choice but to work on that, even if The political environment at the moment is a bit toxic, particularly because of the positioning of certain leaders. So let's just think very systematically about trust and how we can contribute to the building of trust. And then that brings me to, if we link all the pieces together, we're going to have to work hard on the science. Because without the science guiding us, we get into difficulties. Science is going to be at a premium when it comes to dealing with vaccines. We have so many weird claims being made about vaccines at the moment. It's almost impossible to make sense of them. I watch them very, very carefully. We have a number of vaccines going through phase 3 trials. We have no vaccine that has finished its phase 3 trial. We have no vaccine of proven efficacy and safety. Lots and lots of statements being put out by companies for commercial reasons. But we don't have the vaccine yet. But when we do have the vaccine, there are going to be issues of public confidence in vaccine which need to be properly addressed. There are issues of access that need to be addressed, in particular making sure that the people who need vaccine the most are going to be able to get it first. And there are going to be really major financial issues about how all this is going to be supported. There's been a big build-up in work on this, and that's great. But that work needs to be done in full cooperation, I believe, with the global public. The more discussion there can be about the potential for a vaccine, about how vaccines work, about whether or not we're going to have accessibility to a vaccine in the coming months, how that vaccine will be administered. It's just got to be done properly. I just was printing out the reports on the instructions from the US Centers for Disease Control to counties in the US saying, get ready for vaccine administration on the 1st of November. And thinking, what is this? I mean, fine, get ready for vaccine administration on the 1st of November, but please put it inside a clear strategy. But instead, the strategy is kick WHO one more time, and that will give us the basis for our work. You know, we've got to get the vaccine thinking right, and it's got to be based on the science, based on a true understanding of where we are with vaccines, and based on some appreciation of the value system that's going to surround vaccine administration, in particular equity. Do you know the country with the most health workers who have suffered with COVID and died? It's Mexico. A terrible situation. We've got health workers on strike in South Africa because of lack of access to protective equipment, and a sense that the money that was available for PPE was moved sideways and not used properly, and there's a corruption case. We've got health worker sickness and death all over South Asia, all over Europe and the US. It's not talked about enough. But of course, the primary candidates for vaccines have got to be those who are most at risk, and not those who've got the most money. So the issue around vaccines, science, and values, for me, becomes more and more important. And all of us are going to have to work super hard to push aside the sort of vaccine noise that is just posturing, and try to make sure that this is dealt with as a proper issue. So here I was starting off saying, halfway through the marathon, the tough part is yet to come. And it will last at least as long as the 8 months that we've been going so far. Number one, let's be clear, there will be a surge in numbers of people with the disease and surge of people sick, but almost certainly the figures will be relatively unhelpful because more and more governments and others are realizing you don't want to have large numbers being reported and all the problems that come with it. You just reduce the numbers of tests you do. And it's super simple. You just test those who are symptomatic, or you just test those who are highest priority. And instead, what we've got to do is just say, COVID is here. It's not going away. It's affecting everybody. It's making quite a lot of people really nastily ill with a long-term debilitating condition. Just let's accept it. Doesn't mean we give in, and I was having a debate with WHO technical team. We're not giving in and saying, oh, well, just accept it. We just got to say the virus is here and it's being transmitted and it's not going to stop, but only we have the tools to deal with it. And we might as well put those tools into practice, even if we don't have accurate data on how much COVID we've got. Because otherwise, we're just letting that virus move and it's going to kill and it's going to make an awful lot of people underperform. And I don't think we've started to comprehend just how serious the long tail problem is that Paul Garner has led on. So that was my point one. Point two, only way to deal with this is through integrated local action by everybody, informed by data, if you've got it. But most importantly, people connecting together, working out where the virus is. And I'm coming back to my Greater Manchester example because of the beautiful way in which the leaders, whether they were health leaders or political leaders that we were hearing, simply said, it's about connecting with people and working out where the virus is and bringing them on side as we deal with it. It becomes integrated into the fabric of social organization. Number three, we must recognize that this is going to be done not in a context of money to spend, but it's going to be done in a context of less money available for individuals, for small and medium enterprises, for large businesses, local authorities, for national authorities all over the world. There is just not going to be lots of extra cash. There's no way that it's going to happen. There's no way to print the money and get away with it. No country wants to do that. There's no spare money with the IMF. There's very little spare money available through taxation. Businesses themselves can't suddenly be putting in large amounts of money because they themselves are having really serious problems with their own profit margins. Only a few sectors are doing well. They're in the minority. So we have got to learn to do this in the context of recession. So what is the most powerful variable that we can work on? It's trust. Trust and respect. But that means we have to somehow find a way to deal with those who see it as in their interests to be fomenting hate, disrespect, and mistrust. And that's become almost a new force that we're having to work against. That's with us every day, because that's become a fashion in political leadership. It's part of populism, but it's beyond that. It's actually a tactic by scaring people to win elections and the like. And so whether it's in European countries or countries in the Americas, countries in Asia and Africa, Middle East, all of us are going to have to find a way to work for trust and respect and to actually defend ourselves against the impact of crude efforts to manipulate people through sowing the seeds of mistrust and hate. And then fifth, yes, vaccines are going to be important in getting on top of this thing. I mean, it will be, it's the pathway through, but there's a lot of work to be done. And we need science, and we need really open conversations around vaccines, because I think there's vast amounts of I just think hot air being pushed out at the moment that is unhelpful. Thank you very much indeed for the chance to say these words. I want to, I've got a lot of people to give a shout out to. I want to, first of all, acknowledge Twee. Normally, Twee comes in at the very beginning. We just had a meeting beforehand in which I'd explained to everybody that I'm in this mood of focusing on halfway through, and I really wanted to mark this by a particular focus in my presentation this morning, and you've heard it. And so, Twee, if you'd like to just take us into the part that you normally do at the beginning, that'd be great. After Twee, I'd like Josh Knowles to introduce himself. Josh, you can see already, has been busy at work with his illustrations. We are so pleased with that. I'm going to try to give a special shout out. These are the people, just warning you. I'd like to see if Daya Saga would like to make any remarks. Daya Saga is from the SDG network in Nepal. Daya, we've been really focused on the links between the Sustainable Development Goals and COVID. So I'm going to invite you to, let's say, a few remarks for 3 minutes. I'd like to see whether Farhan Tazab would like to say anything. Farhan, we know you're very focused on ethics, and we wondered whether you would like, from your role in the Faculty of Public Health, to make any comments, or have you got any other points? I'd like to give a special shout out to Carol Prezone. Carol Prezone has been working with me on and off for 40 years in different roles. And Carol, having with your masses of experience from all over the world and your current involvement here in major programs in Geneva, and I don't want to anticipate what you might want to say, but if you'd like to come in, that would be great. I'd like, I mean, there are many people who are regulars here and really very keen to hear from you. It's always good if we could get some words from Loy Rago, especially as Loy has been at the center of an effort to build a collective of this group so that we can stay connected, and Twee has been working with you. Annie Feltham, you've been in my mind while I've been developing these talks over the last few days. It'd be lovely to hear from you. If we can get through comments from everybody, that would be great. I think, you know, just say, am I completely off? You know, am I wrong to be doing this halfway through the marathon metaphor? If I'm wrong, that's important to know. I have a major interview trying to further my discussions with New Zealand media coming up very shortly, and this is going to be part of my points with them. So first, and Anne Hendricks Jenkins of Hunger Project US, it'd be really nice if we can get you as well. Twee, off you go.
Thank you, David. So for those of you who haven't joined us before, we like to hold a poll so we know who's joining us and from where. You should see a window have popped up on your screen with the first question asking you where you're joining from, so please do let us know. Once you've done that, you can scroll down, select your age range. I think we've hit a record with the youngest person today being 3 days old. And then our last question is on how you're feeling today. Very pertinent question after, David, your opening remarks there. Please, at this point, you can answer more than one answer on how you're feeling. So I will leave this open and we'll come back to the results later. Back to you, David. Thank you.
And just to, you know, I am, as some of you know, I am an incurable optimist. I wouldn't be doing this kind of work if I wasn't an incurable optimist. My friend Christiana Figueres, I think it's fair to say she's a friend, I hope she doesn't mind. She calls herself a stubborn optimist, but I go further, incurable optimist. There we go. Now, Josh, Josh Knowles. Twee, by the way, Twee gets the absolute most profound gold star for what she's been able to do in helping us to come together. Twee, thank you. And now Josh. Welcome.
Hello, David.
Any comments so far?
Well, it's very interesting to hear your words, and I feel very heartened by your message of the trust flower. I think that's a really potent image, and obviously I'm thankful for imagery in my profession. It gives me something to draw, and I'm going to really focus on drawing this trust flower and moving away from this the seeds of political and divisive hate speech and that kind of thing. So that's the image that I'm really going to focus on as I carry on drawing this. And obviously the marathon is something that I will really carry with me as a message.
I love it. If you don't mind me saying so, Josh, the way in which you've sort of really brought out in a very visual way. What's the little thing shape on from, as I look at it, on the right of the trust flower?
That's a leg of a runner. That's, I'll just draw it very quickly now, but I will draw it better.
That's the leg of a...
That's going to be the... That's the person in the marathon.
Brilliant. Indeed, Josh.
Thank you.
Twee's given you a big clap. Just to say that I think one of the extra bonuses of doing these briefings is because we have the illustrators alongside us, we can engage with the illustrator and learn how that trade works. Many of us are finding these visual narratives so helpful. By the way, the team is here, and anybody in the team who wants to come in, I mean, Twee's already spoken, but you know, I just want to say, Kath, you're next to me. We always have problems with the microphone with Catherine, or John, or Julian, or others in the team who are on the call want to chime in. Just do so. So now I invite Daya. I haven't asked your permission, but if you'd like to say a word, it'd be lovely to hear from you. I'm sorry to read that the great festival, when they bring out the big chariots, turned into a bit of a mess because people didn't do physical distancing. But I also know that that's often a very emotional time. Daya, do you want to say something? Okay. If you do, that's great. Come in later. If you may have difficulty unmuting. Farhan Tazab, would you like to make any remarks at this point?
Thank you very much, David, if it's possible.
Yes, come in.
Thank you very much indeed. I've actually been listening to these, and I've been very inspired. But it's the first time I've actually come on.
Yeah.
I think there are two marathons here. One is the marathon about the actual dealing with the COVID, but I think it's a greater marathon for us to unify as a planet and to go to the next stage of our evolution, to recognize each other as one humanity. And I think, as you highlighted in one of your videos, what is COVID actually telling us about things? And I think one of the big things it's telling us is us to be more human and to deal with this humanity. And just to give a plug, as you mentioned, the Faculty of Public Health, in collaboration with UFA, a number of colleagues, is very keen to advance the discourse around ethical legal dimensions. And the World Congress of Public Health is happening in a month's time. And we're dealing with the ethic, and I will send with you actually, David, the Congress message, which actually deals with a One Health, One World, One Planet initiative. Yeah. So I think part of the COVID, we need to recognize there is a bigger marathon which we have to run to together.
Thank you, Farhan. I'm so glad that you're here. I'm so glad that you've agreed to speak. And I'm so glad that you mentioned this conference coming up in a month's time. I'm involved in it a bit with Ayman Mohammadides, who's the Dean of the School of Public Health at the City University of New York. And he very much is tuned in to that message. And Farhang, if you've got any more information about this initiative of the Faculty of Public Health, that'd be really, really helpful. Welcome to our meeting. Also want to give a shout out to Dave Harron, who I notice is on. Of course, you can always put another name on your own thing, so it could be somebody masquerading as Dave Harron, but I suspect it's Dave Harron, who's another real public health warrior.
It's definitely Dave Harron.
There we go. There.
And I'm on a beautiful beach in Greece.
That almost.
Can I just say one thing? I've never been more proud than I am today to say I was a colleague of yours.
Ah, we were together at Liverpool School of Tropical Medicine, and we're still very much working together. And Dave has been an inspiration also for some of the work done by Nazim and Vicky Doyle, or he's been part of it. And in one of the Nazim's videos, there is a picture of Dave Harron dancing, just in case you wondered. Carol Prezone, are you still here? I'm looking at my screen. Here you are. Do you want to unmute and just tell us?
Yes, I won't put the video on though for reasons that would become obvious if I did. Yeah, thanks, David. I found as always that was really, really inspiring. What's been on my mind a lot recently, I guess because of involvement in the Orchid project and just reading up some stuff that's been happening around COVID, I just Googled it. Another 200,000 girls and women every year at risk of female genital cutting because they're not at school, and the sequelae afterwards because families are afraid to take them to hospital if they start bleeding for all sorts of reasons. So for about a decade, we're going to be living again with all these effects around COVID, which are not necessarily making their ways into the planning, may not be making their ways into, and I loved what you said, David, about the community responses, because it just seems so odd that 8 months in, we're all having to talk about what seems to be the blindingly obvious, that if we'd done it a lot earlier, some of the community involvement stuff around in the UK about getting, you know, GPs and local nurses and health workers involved would have been just such good common sense. So just sort of mulling over how you can really crank up the involvement of community health workers to help deal with all of some of these other things that are going on. And we all know about the rise of gender-based violence and all sorts. So just thinking a lot about all the stuff that is being destabilized. And alongside that, I've been doing some stuff on sustainable financing in the margins and the way the thinking is going around, I don't know, we don't want to get too detailed, I guess, but around the ACT-A accelerator and how this is being treated as a somehow parallel discourse on health financing when we need to be having one conversation about what are the priorities, COVID, not COVID, but what are the basic priorities for people in this extremely difficult time in a situation where financing is plummeting. So I'm sorry, that sounds like lots of problems and no solutions, but I guess we're all here to come up with the latter. Thanks a lot, David, for the chance to speak.
Well, I was just thinking, you're implying that in the first half of the marathon, there have been an awful lot of missteps made, which were avoidable, and an awful lot of destabilization is happening as a result of these missteps. And just how important it's going to be that we not just confront this, but actually speak out and act. Thank you for your comment on cutting. Marianne Hazelgrave is on my screen. She's up next to me in the images. Marianne has been really strong on what is happening to women, women's health, women's rights, women's well-being, as a result of all the decisions that have been made in the last 7 or 8 months, and just how tough it's going to be to recover the lost ground, which was, I think, your point, Carol. let's stay connected to you. I know you're really busy and not always able to join these sessions, but it's just lovely to be connected with you. Thank you very much.
Definitely no busier than anyone else on this call, so it's great that everyone made the time.
Thank you. Thank you very much indeed. Loy Rago, I mean, you're absolutely committed to bringing people together to deal with this. Do you want to make a comment on your own sense of the possibility of networking and solidarity? Loy, you have the floor. You have to unmute. You just have to unmute to
I need to, am I on mute?
You're fine. You're good.
Okay, okay. No, let me first of all compliment you, because I found your presentation far more sobering than it normally is, and yet confident. So thank you for that. Having said this, I think we need to take action at the so-called local level within nations. So we need to work at the national and local level. And when I say local, all the levels in between. The global level, the thematic level is an add-on, somewhat useful, but not a permanent. Yeah.
Thank you very much indeed. I mean, from my understanding, Lloyd, you are more and more focused on what action we can take to help get that local solidarity functional. And in fact, in some cases, that means really managing the behavior of the centre so that it is empowering rather than disempowering. And that applies whether you're in India, whether you're in Egypt, whether you're in UK, whether you're in the United States. It's just become acute everywhere. And Lloyd, you are leading us on this. Thank you for that. I'm going to invite Jo Nichols at some point to come in if she's okay, and go on whichever strand of the discussion you want to go. But perhaps Annie Feltham, who wants to take an economic line, would like to say a word.
Yes, thanks, David. And actually, for the first time, I felt a bit cheered up today because you said we might be halfway through it. I'm going to hold on to that. If anybody's got any UK experience on primary healthcare and getting the GPs open, please get in touch with me. But I do want to, I know what Loy is saying, and I agree with him, but the quality of national government is getting in the way, or rather the poor quality of national government is getting in the way of acting locally. And that's a particular problem we have here. It can be undermined, and it's such a hard push. So I'm pleased that you're working with Andy Burnham, and also Andy Street is another very important local leader at this middle level. Yeah. I think, how do I express this? We've talked a lot about equity and the political culture. And in order to get the money out, we need to think how we're going to tax. Yeah. So taxing in this country asset and wealth, which is never done properly, would be a good move, but it's extremely political. Yeah. And so all the time, David, we're coming up against what we normally think is the right way to behave, in which case I would fundamentally disagree with, and how we address these equity issues of access and power. Yeah. And I will write a bit on that, but that's where I think certainly in richer countries, that's where we're stuck. And then I think, can I just put out a warning that this week, DFID was rolled into the Foreign Office. Yeah. And there's already threats to our aid budget coming from the Chancellor, and it will need defending, because otherwise we will be spending less money internationally.
So as well as trying to offer better solutions to the redistribution question, we've also got to defend outright, one might say, well, I want to find the right word for it, outright reallocation. So I've used a non-pejorative term, and I've had messages, a lot of messages over the last 48 hours of concern about a decision. And let's now move to Jo Nichols. Joe, you wanted to talk a little bit about governance from your perspective in East Africa. Joe, you have the floor.
Thank you. And just on the last point, it isn't, I think, necessarily just a political decision about reducing official development assistance. We're also seeing that the 0.7% commitment to ODA is going to result in less money being available simply because GDP is going down. So certainly for planning ahead for Somalia next year, we're already thinking about how less money will be spent. But I guess my question is related to both how to make sure that we have as accurate data as possible.
Yeah.
You know, we often know that data is inaccurate, numbers don't get included for various reasons, but other times we're seeing at the moment, because the effectiveness of contact tracing has gone down,
yeah.
the randomness of the samples being tested increases, so the percentage positive decreases, making everybody feel perhaps wrongly optimistic that things are improving. But in Somalia, people are briefing about the situation, about what it was like when COVID was happening, not what we should be doing now. And I guess the thing that I'm struggling with most is, in a country like Somalia, there are upcoming elections, there's Al-Shabaab, 2.6 million people are displaced, 80% of the population is under 35. 8 out of 10 women give birth at home. 99% of women have had FGM. There's measles, there's floods, there's cholera. It's really hard to maintain a focus on COVID-19, either politically, because it's better to show that the government is succeeding in reducing the numbers, or even from a humanitarian perspective. So I guess what I'm wondering is, how hard should we be pushing to really retain that focus, and how can we do it in a way that doesn't make it into the same sort of either or discussions that we've been having about lockdown versus economic growth? Sorry, that was a bit long, David, sorry.
Framing issues in places where there are multiple stresses. Florence was telling me about how COVID is viewed in Mali, and it was a relatively similar style of thing. And it's not helpful if we just simply focus on one issue and to the exclusion of others. I don't have a solution, Joe, but I think it's really important what you've said. And these are words of somebody who's exchanging with people all the time on these issues as part of your work and also as part of your lived experience. Thank you very much indeed. That's Joe, who there with, I saw Zara, I think I saw Zara. That was Joe with Zara in Nairobi. And Anne Hendricks Jenkins is working with the Hunger Project in the US, but she's got some experience from national chapters of the Movement for Community-Led Development in Africa, which, here you are, Anne. Do you want to just make this comment? It's really interesting what you wrote on the chat for me.
Yes, thank you so much for your guidance. I will be sending this out. I facilitate 11 national chapters of the movement. Almost all the participation in the movement is voluntary. And I wanted to give you a quick example of what the integrated local action can look like, because I'm really zeroing in on that. In our Benin chapter, we have 50 member organizations representing over 1,000 civil society organizations. And right when this outbreak started, and the focus was from the government, rightly so, on hand washing and things like that, they saw a gap. And what the gap is that they saw is long-term well-being as we get through this. So they developed their own guidance as a chapter, which focused on how to stay well, and they focused on nutrition and hydration, sleep, exercise, and stress management. They came up with guidance around that. They went to the Ministry of Health. It's been endorsed by the Ministry of Health. It's being distributed across Benin through the government, through the civil society organizations, and the government has also asked them to distribute it through the employers, like the banks. And it's interesting to me how they immediately zeroed in on how this is going to be a long-term thing, and we need to stay well so that if we get sick, we can get through it. We'll have the strength and well-being to get through it. Meanwhile, they have also focused on fast-growing, nutritious vegetables, recognizing that the supply chains are being interrupted. They approached the World Food Program in Benin that feeds 600,000 children lunch. And they're developing a concept where they're going to get the young people in the communities to start growing these fast-growing, nutritious vegetables and link it with the World Food Program's lunch program for the purposes of sustainability and also for local production. And they have like 3 other ideas they're developing with the Ministry of Health. And all of it has come out of these groups of civil society organizations coming together on this platform of how are we going to face this latest crisis. The last thing I'll say is that on the bright side of the COVID situation, to your optimistic energy, with the evacuation of so many INGOs and diplomatic staffs, all of a sudden domestic civil society is in center stage in a way that they have never been. And they are stepping up in country after country. Zambia, Uganda, our chapters are going crazy. We just had 2 new chapters form in Nigeria and Liberia with no grant funds from us because this is the time. So I think after this marathon is over, this re-emergence of integrated local action and the voice of domestic civil society is going to be one thing we should really hang on to. So I'll stop there.
Physically, where are you physically today? Where are you now?
I'm actually based in Jerusalem because my husband is a journalist here. So I spend all day on the phone with our chapters across all of Africa.
Thank you very much indeed, Anne. What a lovely, lovely concept that there has been a surge of excitement and engagement by domestic civil society in at least some of the countries with which you're connected in Africa. What a cool thing. Can I go to NK Sethi? NK, who I've worked with over the years in lots of different roles, is actually very acutely plugged into some of the challenges of dealing with COVID in India. These are huge challenges, NK. Do you want to just give your observations quick? We're out of time, but I wanted to give you a moment. NK.
Yeah, thank you, Dr. David. At this juncture, as the cases are rising, the government is making all efforts to contain the spread and decrease the rate of increase and so on and so forth. But what I feel at this stage, an appropriate communication strategy is required, one, and then locally relevant actions may have to be adopted based on tracking the community behavior. And this would consist of approaches which, depending on the urgency, educative, regulatory, or service. Certainly, constant, clear messages would definitely bring about a behavioral change.
Yeah.
That's in a nutshell.
Thank you.
And
yeah, sorry.
And second, the official machinery needs to present a balanced picture, not indicating that we are good in this indicator at one time, good at another indicator at another time, but presenting a balanced picture so that the community doesn't get complacent. What I observe, now the metros are going to get open and the things are projected as if we are doing very well. Our recovery rate is increasing. People have become reckless.
Yeah.
So that is my observation.
Thank you. And so back to this notion of what are the variables, whether they're quantitative or qualitative, that need to be shared so that communities can stand in their own power and work in the way that Anne Hendricks-Jenkins was suggesting or Farhang was identifying. You know, local action can't take place unless it's informed by good quality information, but the information has to be about performance. In the narrative that Tui and I are putting up, I think it's called Rising to the COVID Ready Challenge. Apparently it is up on our website. I really encourage you to look at it if you've got a moment to see the indicators of how our country is doing. It's doable, and you can give community actors information that enables them to do what NK just said. Karen Kaplan, I've got a sneaky feeling that you're joining from the US. If you are, tell me, I see you're muted, so it may be that, that you can't unmute and tell me, but if you're joining from the US, it's the middle of the night. And to all of you who have joined in the middle of the night, thank you. It's appreciated, and I hope that you find it worth the effort of waking yourself up or staying up so that you can join. I'd like to acknowledge that Chris of Thinking the Unthinkable is on. It's always lovely that you're with us. Chris is really thinking through what are the leadership implications of this. There you are with a scarf around you. It must be cold where you are, Chris. Perhaps you're in your basement at home. Thank you for being with us. I'd like to really acknowledge all the team and then just Twee, could you give us the results?
Absolutely, here we are. So great to see we've got a few people from East Asia Pacific, as that's the time zone we're in. And we actually have 2 people from North America, perhaps joining late in the night there. And a very nice spread across the different age ranges. And then in how everyone's feeling today, great to see the majority are optimist or hopeful, and then a spread across there. A few discouraged and doubt, but no one in the very, very bottom tier today, which is very nice. Thank you. Back to you, David.
Thank you. And in a funny way, optimism and hopefulness and pessimism and frustration coexist in most of our minds, because we're all people who operate inside paradox. We've learnt in our work that there are no simple solutions to any of the issues we're dealing with. There are always multiple ways of looking at them, and to be comfortable with paradox, which I've learned from so many of you, is so important. There's something from Serkan Metan on the chat, but I think we've probably run out of time, and I need to be fair to you all. We've all got work to do, including our team. Just, John, did you want to speak? John Atkinson.
Very, very quickly then. Just for me, this thing about acting locally is a mindset. And if we're saying people are the solution and the virus is the problem, then we need to talk to people and we need to listen to them and we need to learn from them about how they think and what they want. And if we don't start there, we don't really change what people do and we don't get the thing that we want. And Manchester that you've been talking about, some of that's been going on for decades, and that's why they're able to do the things they do. So start with people and listen to them.
Yeah. Thank you, John. John also, in his life, said if you want to work with people and listen to them, you have to be in their place with them, not sitting in some faraway office, just connecting on the telephone or whatever other medium you use. He called it total place, and I think it's a very relevant way of working. Okay, anybody else from the team wish to say anything before we close? 3, 2, 1. Thank you very much, everybody, for joining us. Thank you so much for all the comments that are in the chat. This time we're harvesting the chats and using them to build the next narrative. In this particular discussion, there's been such a lot of richness, and it's come from each one of you. Enjoy, see you soon. And once again, where we started at the beginning, welcome to our youngest participant, Otto Fawcett.